Hi everyone, my name is Kellen Jackson, and today we're going to be talking about a health promotion project for Beadle County. To get started, we'll talk about the makeup of Beadle County. So it's located in the east central part of South Dakota with about 12,000 square miles of land and 6 additional miles of water. The population is roughly 19,000. 14,000 of those residents are in Huron, leaving about 5,000 in the 17 other towns, making this area very rural, and travel is often required to obtain essentials for living. The ethnic makeup is 72% white, 12% Hispanic, 10% Asian, and about 18 of the households speak a language other than English. The income of Beadle County is lower than the national average by about $20,000. And poverty is up to 14.5%, which is higher than the national average as well. So, a brief overview of the community here. Healthcare, they actually only have one hospital within Beadle County. There are other medical facilities, but most people do have to travel to receive access to care. The same goes for physical fitness centers. There's actually only 4 in the entire county. As far as jobs go, most people are either educators, health providers, they do construction, public administration, or agriculture. And there's actually over 700 farms within Beadle County, which contributes to it being a very rural area. So with a rural area comes many health considerations. One of these is chronic disease. It's been found that rural counties run a higher risk for health concerns, partly due to the lack of access to resources. Higher rates of smokers, high blood pressure, and obesity are common among residents in rural areas. Today we're going to kind of hone in on type 2 diabetes. What it is when the blood sugar levels are too high and the body isn't using or making enough insulin to disperse that sugar into the cells. Type 2 diabetes is a concern because it leads to an increased risk for many other health problems. You can see in the picture all of the health problems that may occur when someone has diabetes, including stroke, heart attack, cataracts, many more. Type 2 diabetes is a concern in Beadle County. Some of the contributing factors is that diabetes is more common amongst Hispanic American Indian and Asian American populations, all of which reside in Beadle County. Another factor is obesity, and Beadle County has a 33% prevalence. Language barriers also play a role in the developing of type 2 diabetes. Communication is essential in decreasing the risk. Some statistics in Beadle County. Number one, rural counties have a 16% higher prevalence of type 2 diabetes and a 20% higher mortality rate. Beadle County specifically has a prevalence of 9.5%. To combat for this disease, an intervention needs to occur. Nationally, there has been a program created by the CDC, the National Diabetes Prevention Program. It was created in 2010 and it utilizes a lifestyle program to reduce the risk of diabetes. How it works is there are weekly meetings that are put on by a lifestyle coach where participants get to check in, get updates, and then also learn more about how to prevent diabetes. The program is compiled of 2 different parts, each run for 6 months each to ensure that participants can continue living this healthy lifestyle. One concern is that the program is not currently implemented within Beadle County and the closest center is over 60 miles away. However, the program has had great results. The program found that participants had a 5 to 7% decrease in body weight. It's also added 150 minutes of exercise to participants' weekly routine, which helped to decrease their risk for developing type 2 diabetes by 58%. Even a decade later, participants have shown to be 33% less likely to develop type 2 diabetes. This picture just kind of shows the curriculum for the CDC's program. The first 6 months, you can really see them just getting started, looking into what they're doing and how to do it. The second part of the program really focuses on maintaining and continuing what you've been doing. So feel free to read all those and see what the program consists of. So the CDC's program is great. It has a lot of beneficial information, but we need to adapt it a little to fit the needs of Beadle County. The first step is funding. The CDC allows each facility to determine the funding of their specific program. And Beadle County could do the same thing. Ideally, the Huron Regional Medical Center would be the organizer for this program. They actually accept donations to support their mission of promoting health and well-being in the community. The second step is to modify the delivery to fit this county's needs. So the traditional delivery by the CDC is in-person classes. However, due to the rural area, allowing for an online delivery via Zoom will ensure maximum participation. Participants can log on to Zoom, watch and participate in the program, and then results can actually be tracked individually via breakout rooms and the text communication feature within Zoom. Online delivery will also allow for friends that live further apart to participate in the same program. It's actually been shown that friends utilize each other to aid in accountability and improves results. The second step for modifying delivery is addressing the language barrier. Since much of the population does not speak English, 2 programs will be broadcast. There'll be an English and a Spanish version for this program, as Spanish is the second most common language in the county. Step 3 is gathering participants. We need to get as many participants as possible in order for this to be effective in Beadle County. Some of the ways we can do this is utilizing healthcare professionals, flyers and brochures, online platforms, and of course word of mouth. The materials dispersed need to include key details such as the program being free and online, and also they need to be dispersed in Spanish and English. Following these 3 steps, we can adapt this program to make it an effective program for Beadle County. We already know Beadle County is heavily affected by type 2 diabetes due to the barriers they face. This modified program is combating for those barriers. The program has already been effective in other areas and can do the same within this county. The Adapted Lifestyle Change program can aid in combating and decreasing the rates of type 2 diabetes amongst Beadle County. Thank you all for watching this presentation, and here are my references.